Dialogues. I'm Mr. Zaman, and today I'll talk about: can taking statins after a bleeding stroke lower risk of another stroke? People who have had a stroke called an intracerebral hemorrhage, who take cholesterol-lowering drugs called statins, may have a lower risk of having another stroke, especially ischemic stroke, compared to people who also had an intracerebral hemorrhage but were not taking statins, according to a new study published in the online issue of Neurology. For the study, researchers looked at health records in Denmark and identified 15,151 people who had a first bleeding stroke. People were followed from 30 days after their first bleeding stroke until the first occurrence of another stroke, death, or the end of follow-up, which on average lasted 3.3 years. Researchers then compared 1,959 people who had another stroke to 7,400 people who did not have another stroke, who were similar in age, sex, and other factors. Of those who had another stroke, 757 people or 39% took statins, compared to 3,044 people or 41% of those who did not have a second stroke. After adjusting for factors like high blood pressure, diabetes, and alcohol use, statin use was associated with a 12% lower risk of another stroke. Then they compared 1,073 people who had an ischemic stroke to 4,035 people who did not have another stroke. Of those who had an ischemic stroke, 427 people or 40% took statins, compared to 42% of those who did not have another stroke. After adjusting for similar factors, statin use was associated with a 21% lower risk of an ischemic stroke after the initial bleeding stroke. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.